Thank you very much. It's a pleasure to be able to talk today. When I was asked to talk, I thought, well, you know, I'm going to be talking about three things. That would be great. You can think of it as the three amigos. But then I got to thinking that, you know, fatigue, apathy, and sleepiness are not jolly, hearty, comedic ideas. So I decided that's not a great way to start a talk. And I had to think about what else could I do with three. Three Musketeers that didn't sound right. Seven Dwarfs is too Disney. So I decided this maybe fit the bill, except there were four. And so I had to fudge a little bit and sneak depression and anxiety in there. To hear about those, you have to go to a different session, but stick with me, and we'll deal with the other three in the next 25 minutes or so. Neuropsychiatric symptoms are very varied in Parkinson's disease. They run the gamut through the five horsemen, if you will. They're common, they can be disabling, and it's important to remember that, I just realized, we have this nice monitor down here, but none of the speakers can see it. It's over here. So I'm going to do this. We often just talk about patients and the effect of Parkinson's disease on patients, but non-motor features and things like apathy and fatigue in particular clearly affect not only the patient, but also spouse, family members, friends, and everyone else. So let's get going and talk about apathy, fatigue, and excessive daytime sleepiness. And for those of you who are autistic, I know that that's Durer's representation of depression, not apathy, but I did the best I could. The word apathy itself was actually derived from the Greek apatheia, which means without passion. And originally it didn't have a bad connotation. It referred to an ideal stoic calm that a philosopher should strive for. And the word apathy was first used in the context of Parkinson's disease way back in 1895 by Edward Rousseau. A definition that you might use for apathy goes like this: a lack of motivation characterized by diminished goal-oriented behavior and cognition and reduced emotional expression. That's kind of a mouthful. One way to think of it, though, is like this. It's people who are apathetic have reduced emotion, they have diminished motivation, they lack initiative, they have difficulty sustaining an activity. That's all bad enough, but what can be tremendously frustrating for family members are the last two, that with all of these things, the person who is apathetic doesn't care that they have all those things. There's a lack of concern and even an indifference to their state of cognitive and behavioral function. These are a collection of some comments that were made by family members of people with apathy, and I think they reflect sort of the frustration and even the despair that family members can be forced to deal with, describing your loved one as more and more lazy, doesn't start or finish things, nothing to say, doesn't show any emotion, stares blankly at the television all day, no interest, no enthusiasm, couch potato, doesn't care about anything anymore. That gives you sort of the essence in everyday life of apathy and how it affects people. So, is that a common problem in Parkinson's disease? Often when I talk to patient groups, I ask people to raise their hands. I won't do that. With apathy, I probably wouldn't get it. So, looking in the literature, a recent meta-analysis where they analyzed multiple studies showed that almost 40% of people with Parkinson's disease are troubled by or afflicted by apathy. Compared to, and you'll see figures between 0 and 20% for comparably aged people in the general population. One of the difficulties in talking about and conceptualizing empathy is that it's so easy to confuse and infuse both depression and cognitive impairment with and into apathy. And indeed, they do correlate quite a bit with each other. Studies have shown that persons with apathy are more than 2 times as likely to also have depression, and people with apathy tend to score lower on tests of cognitive function. One of the MMSE is one of those. But apathy can and does occur independently from depression and from cognitive impairment. Studies would suggest that a little over 20% of people with Parkinson's disease may display features of apathy without any depression, without any cognitive impairment. Apathy tends to be more likely to be evident in patients who are older and in patients who have greater motor disability. Some researchers have divided apathy into subcategories or subdomains, reflecting to some degree different parts or clinical features, some degree different anatomical localizations, and to some degree different neurochemical involvement. And so there's one part of apathy that has been dubbed reward deficiency syndrome, and that deals with or refers to the emotional blunting, the diminished emotional resonance that a person may display. A second subdomain would be emotional distress. This is sort of the depression or depressive part of apathy. The next is executive dysfunction. That's sort of the cognitive feature, if you will. And then the auto-activation failure, the ignition switch doesn't get on, people can't get going. That having perhaps to do with dopamine, whereas the executive dysfunction may be more correlated with acetylcholine, emotional distress perhaps with serotonin, and reward deficiency again perhaps with dopamine, again reflecting a bit of what Ray Chowdhury mentioned earlier. This is just a pictorial representation of 3 of those subcategories, showing, I think all I want you to catch is that the different areas of the brain seem to be involved, at least to some degree, in these various features. Separating apathy from depression can be difficult because they have these overlapping symptoms. People who are apathetic and people who are depressed will typically display psychomotor retardation. They can't enjoy things. They don't have energy. They sit around and don't do much of anything. They're not enthusiastic about anything. So how do you separate them out? Well, if a person displays emotional symptoms, sadness, feelings of guilt, pessimism, self-criticism, anxiety, that suggests more a depressive symptomatology, because apathetic people tend not to have feelings. It doesn't bother them that they're not doing these things, and instead they show the symptoms that are listed over on my left-hand side here: emotional indifference, less affection, less concern for the feelings of others, and so on. One other area that apathy has gained some attention in is the relationship with deep brain stimulation surgery, specifically subthalamic nucleus deep brain stimulation surgery. And it's been reported in a number of papers now that after DBS surgery, there's an increased incidence of apathy. And indeed, the reported prevalence in papers, it ranges from 23 to over 50%.